In the vast and still largely mysterious world of the human microbiome, bacteria have long taken center stage. From gut health to immunity, from mental wellness to metabolic balance, countless studies have illuminated the critical roles that bacterial populations play in our bodies. But a quiet revolution is now underway, bringing long overdue attention to a smaller, often overlooked group of microbial residents: fungi. These microscopic organisms, once dismissed as mere bystanders or occasional troublemakers in the gut, are emerging as potent influencers of human health. A recent study from China has brought this into sharp focus, revealing that certain intestinal fungi may actually help slow the progression of liver cirrhosis, a chronic and often fatal disease affecting millions worldwide. What this study hints at is not just a new frontier in medicine, but the possibility of life-saving fungal-based therapies in the not-so-distant future. The study, which examined the composition and function of gut fungi in patients with liver disease, identified one particular species that appears to play a protective role. While the precise mechanisms are still being studied, early data suggest that this fungus modulates inflammatory pathways and strengthens the gut-liver axis, a critical connection that links intestinal health with liver function. In cirrhosis, where the liver becomes scarred and increasingly dysfunctional, the gut microbiome can often exacerbate the problem by allowing harmful bacteria or metabolites to leak into the bloodstream. The protective fungus, by contrast, seems to help maintain the integrity of the intestinal barrier and reduce systemic inflammation, effectively shielding the liver from further damage. This finding could mark a paradigm shift. For decades, cirrhosis treatment has focused largely on managing symptoms and slowing deterioration through lifestyle changes and medications that come with side effects. But the notion that something as natural as an intestinal fungus could alter the trajectory of the disease offers a fresh, low-risk, and potentially transformative path. Unlike synthetic drugs, which often need years of testing to ensure safety, this fungal species already resides in many healthy human guts. That gives researchers a head start in understanding its interactions with human physiology and reduces the likelihood of adverse effects. Beyond the practical applications for liver disease, this research elevates the importance of a broader field known as microbiome science, the study of fungi in the human body. While it's true that bacterial imbalances have been linked to conditions like inflammatory bowel disease, obesity, and depression, it's becoming increasingly clear that fungi are not passive passengers in this microbial symphony. They communicate, interact, and even compete with bacteria, shaping the gut environment in subtle and often powerful ways. The idea that certain fungal species might offer benefits beyond digestion, such as reducing fibrosis in the liver or regulating immune responses, is a thrilling development that underscores how much we still have to learn. What's especially exciting is that fungal-based therapies could be tailored to work synergistically with probiotics and prebiotics, expanding the toolkit for personalized medicine. Imagine a future where a patient at risk of liver cirrhosis receives not only dietary advice and pharmaceuticals, but also a microbiome profile and a targeted fungal supplement designed to reinforce their internal defenses. Such an approach could dramatically reduce the burden of liver disease, particularly in populations where access to advanced medical interventions is limited. Moreover, this discovery opens the door to deeper ecological thinking about human health. Rather than viewing disease as something to be fought with ever stronger drugs, it encourages us to understand and cooperate with the microbial ecosystems that live within us. Fungi, with their ancient evolutionary lineage and complex biochemistry, may hold answers to problems we've long considered intractable, not just liver cirrhosis, but other chronic conditions driven by inflammation and immune dysfunction. It's still early days, of course. More clinical trials are needed, and researchers must carefully explore the long-term effects and possible interactions of introducing or amplifying fungal species in the gut. But the promise is real, and the scientific community is responding with growing interest. Already, biotech firms and academic labs are mobilizing to investigate the therapeutic potential of fungal metabolites and their role in interkingdom signaling, the language through which bacteria, fungi, and host cells communicate. In short, this study is not just about one fungus or one disease. It's a signpost pointing toward a more nuanced, integrative view of health, one in which the hidden players of the gut microbiome are given their due recognition. The humble intestinal fungus, once seen as irrelevant or even harmful, may soon take its place among the most valuable allies in human health. As research advances, what was once invisible and misunderstood may become a cornerstone of 21st century medicine, a life-saving gift from nature's most underestimated kingdom. Would you like me to explore the specific fungal species involved in this study or the detailed mechanism by which it influences liver health?